Welcome, Michelle. Welcome to the university. Interesting question for you. You're working in a children's ward.
Mm-hmm.
One of the children needs an operation,
Yeah.
but the parents aren't agreeing. They don't agree with what you're recommending. They don't want the operation. Should parents have the final say on whether a child has a treatment or has an operation?
So I'm working in a children's hospital,
Yes, you are.
and the child needs an operation, and if the parents should have the right to determine that.
Yeah. In this case, they are disagreed. They don't want the operation.
Okay. So I definitely first of all approach it in a way where I'm looking how serious this operation is. Is it really medically needed? Is it life-changing? How old is the child? Plays a big role as well. Is the child still... It's a big difference if the child is 13 or 5 and what it is. So if it's medically needed, the operation, if the child is struggling from something, and just furthermore, what is the child saying? Does he or she want this operation? What are their point of views on this? And furthermore, just where the parents are coming from. So just try to emphasize with the parents, see from their point of view, is it maybe that they would be okay with this operation and they would be able to see that it's medically necessary if the doctor would explain it to them step by step, and they might be scared of operations, or they might have had a past experience which wasn't so good, which can lead to people being very biased towards things like this, where I would just really speak to the parents one-on-one and really find out why they have made up their mind. And then after this, if they still are disagreeing and it is a medically necessary operation which could otherwise impact the child's life and quality of life, I would definitely get more opinions involved, so other healthcare professionals, just to make sure to give the best treatment possible to the child which they deserve, and the autonomy of the child, so just to ensure it is the best possible treatment. And furthermore, just if the parents have custody over the child, so it might be the case where obviously there could be a lot of different scenarios. So the child might be in care or live with somebody else, and the parents may have lost the custody over their child, for which they are just not in a position where they can make these choices for a child's life. Although they are his parents, they are not in a position where they have the custody and can choose such big things. So is he in care? Does he have a foster home? Maybe see who his carer is, or just take it maybe to a legal matter, so get multiple doctors, multiple healthcare professionals, mental health specialists, to see what the best conclusion is this really necessary? And furthermore, just if the parents are capable of even making these choices for their child's life. And yeah, that's how I would tackle it.
Okay. So the question that we were focusing on is, should parents make decisions on behalf of their children? What do you think we should think about here?
I think we're definitely just thinking about how old is the child, first of all. So obviously, if the child is underage, the parents would typically tend to pick up and be able to make choices. But if the child was of age, of legal age, they themselves would be able to decide. So again, it's just really understanding if the parents are coming from a reasonable background, if they do have a ground to stand on, or if it is just really medically necessary. And this is otherwise, if they were to opt out, in this case, how the parents are disagreeing, it could impact the child's life. And it just really just, I think, understand where the parents are coming from. So with me as well, when my sister, so she had a issue with her jaw and she needed to get reconstructive jaw surgery, just to make sure that her jaw would not dislocate in the later years. And at the time I was living in Germany, and my parents, so my mother had a previous incident with her sister in England where the NHS decided it was best to not do this operation. And the same happened with my sister, but in Germany, the doctors really insinuated on this is what's best for her.
Okay.
So I think it's just that difference of their past experiences may have not been that good, but we did resolve this issue by really understanding the doctor and speaking through everything. So the healing process, the complete operation, what is going to happen, why is it necessary. If this operation does not happen in her case, it could have further implications in the future and she would struggle with a lot of things. And also maybe the costs. A lot of the time, some operations are not covered by the NHS, which parents are just not able to afford, and they aren't from wealthier backgrounds, and there's maybe waiting lists, or they just aren't able to make up that amount of money to afford it, which again is something else that could be put into place. Maybe waiting lists or step-by-step guides or other things you could do instead of the operation, and maybe it would still be preventable at this stage. If something has been caught earlier on, you could maybe prevent it by other alternatives. So yeah, definitely just...
Okay. Thank you very much. Lovely.
You're welcome.